6:41 is the time. Welcome back. A study shows stimulant medications may lead to less severe symptoms in children suffering from ADHD. Autism rates are on the rise, but we've got Dr. Hebert who says there's no reason to panic there. Also, there's a new drug that targets undetected cholesterol, which could decrease your risk of heart disease and stroke. So a lot to dive into here.
A lot.
Where do you want to start?
I want to jump right into this ADHD thing.
Okay, let's do it.
I have a very serious issue with people that have ADHD that are not getting the appropriate treatment or the appropriate diagnosis, folks. So if your child, especially a girl, makes straight A's, but when she comes home, she can't really focus, or she's, really not being able to do things in order, or she just kind of seems a little not able to really do things around the house. Just because she has straight A's does not mean that she does not have ADHD, okay? And people will tell you that, oh, my daughter makes good grades, or the doctor might even tell you, just because she makes straight A's, she can't have ADHD, or he can't have ADHD. That is totally incorrect, so I just kind of want to throw this out there. But from the Journal of Neuropsychopharmacology, there was a study that came out recently that showed that if your child actually gets stimulant medication between the age of 9 and 10, they looked at 7,000 people here, and this is stimulant medication, not non-stimulant medication, then the brain can actually start to increase the density in certain parts of the brain, in the amygdala and the caudate nucleus. So what does that really mean? It means that if you have a diagnosis of ADHD and you are on a stimulant, the odds of your brain being almost repaired because of the medicine started earlier in life means that you have a better outcome and a better chance to really do well. ADHD is not that big of a deal if you address it early. So don't just let anybody tell you that you just need to not be on medicine. Medicine is not for everybody, but what I am saying is that therapy is the number one thing, and then you need to address any medication. Now, there are a lot of folks out there that saw some data out there that said, we were talking about autism, and autism is on the rise. 1 in 10,000 people in the 1960s. So I did the research on this, and I'm kind of going to read this for you because it was 1 in 10,000 65 years ago, okay? All right, so now we look at why. So there were no diagnostic criteria. The patients that had a diagnosis, or people thought they were autistic, were institutionalized. They thought it was a form of schizophrenia, and even from something called cold mother syndrome, meaning that your mom was cold and that's why you had autism, okay? But that was 65 years ago. Now, it was 1 in 2,000 in the 1970s because people actually got a diagnosis. Then in the 80s, it was separated from schizophrenia by the DSM-3, which is the diagnostic criteria manual that we use as physicians. So it went down to 1 in 400 in 1987. So you see what's happening here. People are seeing it more, diagnosing it more, so therefore the numbers are plummeting. Numbers are going up, rather, meaning of the people that have the diagnosis. Then in the 90s, it was qualified as a diagnosis for you to be able to receive special ed services. So what happens then? More diagnosis. So that was 1 in 150. Then in the 2000s, down to 2008, it was described as a spectrum, which means that all types of people could be having that diagnosis because it was not just the strict diagnosis code that we were using before. And then the DSM-5 included other diseases like Asperger's disease. So now it's down to 1 in 36 in 2015. So it doesn't mean that we just started seeing that much more. It just means that people started learning more about it. People started understanding more about it. People realized, well, there are more people with this. Now, with that being said, with ADHD and autism, I want to be very clear. I'm not saying that there are not toxins in our food and all other types of things that could be increasing this, okay? But what I am saying is that you got to be careful with the numbers to say that it went from 1 in 10,000 65 years ago to 1 in 36 now, okay? That's the other thing. Now, I'm going to throw this out there because it's really important. There's a study that came out very recently, and there's a drug called lepodisiran. Lepodisiran, and bad cholesterol it causes all types of myocardial infarctions and strokes and these types of things, right? But this bad cholesterol, lipoprotein A, is the absolute worst. But there's this new drug that is showing that it will decrease lipoprotein A by so much that it's almost gone in the bloodstream with one dose of the medication, okay? And this drug is made by Eli Lilly, decreases stroke and decreases heart disease, decreases myocardial infarction, okay? It is not out right now, but it is gonna be coming out soon, so I just want you to pay attention to that. But please, if you're out there, back to the ADHD and autism, please get your child evaluated or yourself evaluated and take some medicine if you need to.
All right, if you missed any of this conversation and you want to catch it, we have it on our website. You can follow that interview on WLTV.com. You can also find any previous conversations or information that Dr. Hebert has shared with us.